Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. A very good morning to all, and it was raining babies in the night. I was in the hospital. One delivery at 2 o'clock, another at 3 o'clock in the morning, and another delivery in process. So I am in the hospital today, and I thought I'll do the live on time and in my scrubs. So it's all about profession and it's all about pregnancy and delivering babies, and it's very exciting. And then today's topic, I wanted to talk about your first visit to the doctor when you're pregnant. What all to expect and what all will be done in your first pregnancy visit is what I wanted to discuss today. As a part of the pregnancy care and visits and antenatal care, this is my first class about antenatal care. And whenever people are pregnant, they should schedule an appointment to the doctor as soon as possible, because there are particular notions that might be in the house. People say, and others say, elders say, that once you cross 3 months you should go to the doctor, and before that there is no need of going to the doctor. But that is absolutely not true in the current scenario. As soon as you miss your period and you have doubt that you are pregnant, you should get a home pregnancy test done, which is actually giving you almost accurate results in about 3 or 4 days of you missing the period. You at least get a faint second line in your urine pregnancy test kit. That is some kind of a prediction that you might be pregnant. This is all for periods, whose periods are regular and who are trying for a baby, and they can expect that they can be pregnant. And for somebody who has irregular periods, if your cycle has extended more number of days than what you actually predict, then you should go for a pregnancy test at home. If you have any doubt, actually doing a blood pregnancy test, the beta HCG pregnancy test in the lab is also a very good option, because you get the report in about a couple of hours, and you will be at least it's a very good modality of testing 100% accuracy of pregnancy somewhere in the body. And as soon as you think you're pregnant, you have to schedule your first pregnancy appointment, and remember what all you want to talk to the doctor. Make it a point that you note down, and make it a point that you don't miss anything, because the doctor might ask you about your periods, about your cycle length, frequency, the blood loss, and your actual gynecological history, and about your past pregnancies, about your contraceptive methods, about your family history of any hypertension or diabetes or obesity or any familial problems that you've had running in your family, and exposure to any kind of drugs in the recent past, for example, any antibiotics, any history of fevers, or any history of cold, cough, flu in the past, and any exposure to potentially harmful substances. That might be some kind of a important point to be noted. If there is any use of any the ongoing routine medications that you're using, your prenatal vitamins, you have to show your doctor what prenatal vitamins that you're using. And if you're using any prescription, maybe you have any hypertension, diabetes, or epilepsy, or thyroid issues, or any issues with prolactin, or any issues with already usage of some medications for any autoimmune diseases, or any prescription that you're taking, that also you need to show it to your doctor. So it's very important that you carry those important documents, and you have to tell the doctor what all medications that you've had in the recent past. And your history should definitely have the exact amount of amount of alcohol or tobacco or coffee or any substance that you used in the recent past that can impact the pregnancy outcomes. And if you've traveled anywhere, probably to any zones where you have had history of malarias or history of any other problems, or any high alert zones for COVID, the recent the pandemic. So you have to tell your history about travel also, and any past history of infections like tuberculosis or any past infections that are very significant. You have to tell your doctor, and you have to share the information about sensitive issues like domestic abuse, or any abortions in the past, or any non-prescription medications that you have used in the past, because it is very important to help your healthcare provider take the best care of you. And it is all about pregnancy, it is all about safety, it is all about well-being, it is all about caring, and it is very, very important that you should be transparent to the doctor. And there, in the first visit, there would be a discussion about your due date. Nowadays, people ask me in the very first checkup that when will I tell you, doctor, what is my due date? Usually, for a rough estimate, due date is the day that is 40 weeks from the last period that you've got. But then, if there are any irregularities in your period, and there would be a dating correction, and your due date will be different for different situations like irregular periods and people who have early periods or late periods, your due date will shift accordingly. And when you have to talk about due date, nowadays the due date comes wherever I'm giving my services, it comes in the report of the NT scan with all corrective measures, and that's the exact way to predict your due date. If you have any regular periods, if you have regular periods, almost it's going to be at the same time. And in the first antenatal visit, there would be a proper physical examination of your height, weight, your body mass index, your heartbeat, your breathing rate, and your blood pressure. So all these things are very, very important, because these are your baseline values, and never miss your baseline values, because tomorrow if there are any fluctuations, you will actually know what normally you had in your first visit, and that has to be documented. And especially the weight, especially the blood pressure, especially the BMI. And it is very important that your actual vitals are properly documented and taken care of. And in the first visit, if you are not undergone any pap smear, that's the best time to take a pap smear test also, because you will not miss screening of cervical cancer, and that's what the protocol is. So you don't miss any pap smear examinations. And the first visit, usually we suggest for pap smears also. And your breast examination, questions about your breast health, and your heart and lung examination, and all these things are a part and parcel of the first visit. Now, the first visit is the time when we actually do your health assessment, your laboratory tests to check your current situation. So the lab tests that we actually do in the first visit are your basic tests to test your hemoglobin levels. That's very, very important. Test your blood group, because your blood group is also very, very important. And if you are negative blood group, you have to be very vigilant. You have to do your you have to do your Coombs test to check for any antibodies. And your hemoglobin level is very, very important, because if you have low hemoglobin levels, it means it can impact pregnancy, and that is the time to be alert. And there are routine tests like your blood sugar test. That is really, really important in the current scenario. And if you have history of polycystic ovaries, or if you have history of obesity, or a pre-existing diabetes, or strong family history of diabetes, we even do your HbA1c, the 3 months average blood glucose level. And there is also screening for viral infections like rubella, and certain places they even check for chickenpox antibodies also. And the major viral infections antibodies, viral infections checking that we do are for the HIV, the hepatitis B, the hepatitis C, the common test like syphilis. All these things are regularly done just to know if there is any exposure, because early pregnancy treatment modalities are very important, just in case if you have any of these infections, because they are very much going to influence the pregnancy outcomes. And you have to check for urine infections also, because urine infection is one of the most cumbersome, problematic, subclinical urine infections are very problematic during pregnancy, and they flare up during pregnancy because of altered immunity levels. And it is very important to check your urine infection status also. And the first checkup, you will have an idea when you will have your early pregnancy scan. So we'll have one session on an early pregnancy scan and what to expect during your early pregnancy scan. And if you're 6 weeks or so, then your early pregnancy scan will also be scheduled. And about the genetic tests and the genetic abnormalities of screening Down syndrome, and all these will also be discussed in detail during the first antenatal checkup, and the dates for the particular test will be given if necessary. And about your lifestyle issues, it is very, very important to discuss with the doctor about your lifestyle issues, about your exercise, about your sexual pattern, about your dental care, about your vaccination schedules, about your travel during pregnancy, any other lifestyle issues that you really want to discuss, about your especially about your exercise and diet regimes. And you would even have to give information about your work environment. How do you go to work? How many hours of work? Are the work timings suitable for pregnancy? Or do you have are having normal sleep pattern or a disturbed sleep pattern, or your stress levels during pregnancy, or if you are any specific medications that really are going to impact pregnancy. These things are very, very important. And in fact, it is very important that you have to discuss about your smoking, including passive smoking, alcohol intake, and any substance abuse or drug abuse that you already have in your history that you have to tell, because these influence the pregnancy outcomes. And you can discuss, and you'll be asked by the doctor about your normal discomforts. What has changed in this pregnancy, like nausea, vomiting, headache, giddiness or backache or lower abdominal pain, weakness, drained out feeling, or increased sleep pattern, or no sleep, decreased sleep issues. All these things, because these are very, very traditionally attributed to the new pregnancy that has come. So you can have morning sickness, you can have lower abdominal period cramps that might worry you, because you might get a feeling that you might get your period, or you can have a miscarriage kind of tension in your head. But all these things can be discussed, can be sorted out, and can be taken care of. And the next visit planning will also be done, especially when you go for an early pregnancy visit. Actually, when is your appointment scheduled for the scan? What would be your next pregnancy visit? When to see the reports? How to check? All the other things are going to be discussed. And what is really important these days is your thyroid test. And nowadays, thyroid tests have been showing a lot of fluctuations in pregnancies, and the normal values in pregnancies are different. And it is very important that your caregiver gives you reference ranges for pregnant women also, because you keep checking that, say, for example, if you take the question of thyroid, and the normal value of thyroid, maybe it's about zero point 0.5 to 5.5 for a normal average person. But in pregnancy, the value should be less than 2.5 in the first trimester, and less than 3 in the third trimester. So the normal reference ranges are very important. So if your value is between 0.1 to 2.5, then you're in the good range in the first trimester. And if it is 0.2 to 3, it is good for the second trimester, and 0.3 to 3 is good going for the third trimester. So these kind of reference ranges are different for different phases of pregnancy. So you should not panic if there are any variations, or if it is falling in the reference range for normal people. You should not take it for granted. Always check your reports to the doctor's office and make sure you don't miss any of the reports, because these are to be checked at the right time to give the right advice. And the next prenatal visits will be scheduled accordingly, according to the need of this pregnancy. And the first pregnancy visits, people have loads of doubt: how to walk, how to sit, how to eat, what to eat, what not to eat, and how to take care of the nausea, morning sickness. And there are several doubts. So make it a point that you write down all your doubts and go to the doctor's office, because pregnant women, or for any matter, people tend to forget when they have to remember things at the actual time. So it is important that you take notes of everything that you really want to ask the doctor. And if you are a health freak, if you're a person who is very conscious about health, then you should be talking about extra questions also. And it is very important that you take your regular vitamin supplementations. I usually suggest folic acid, B12 and DHA, along with a dose of vitamin D injection and vitamin D supplements, which are mandatory in the first checkup itself. And it's an ongoing process to continue your folic acid and B12 all throughout the first trimester. And nowadays it is very helpful that you start folic acid even before planning pregnancy. So the same medication can be continued in the first trimester also. So I give a combination of folic acid, B12 and DHA, so that takes care of everything that is needed during pregnancy. And make sure your vitamin D levels are checked if you have history of low vitamin D levels, and take care that if you have any nutritional deficiencies, they have to be checked for once again in your early pregnancy. And when we talk about the medication part, it is very important that you have your current medications tailor-made to the safer drugs that are safe in pregnancy. And also there will be dose alterations in pregnancy, because there will be fluctuations in your doses if you are using medications. For example, if you are on thyroid 25, you might need a higher dose in pregnancy. And if you are on anti-epileptic medications, you might have to change the brand or change the quantity of medications depending on your changes. And if you are on medicines for multiple medications for diabetes, it is very important that you shift to insulin as a safer perspective, just in case if you need. And if you are on any antihypertensive that is not suiting for pregnancy, you might have to change the medications. So these are the most important things, and I don't think so I've missed anything, but these are the most important things that you have to take care in the first antenatal visit. Do talk to your doctor about what exercises that you do, are they safe in pregnancy or not, and what you can do. I usually suggest no machine exercises in the first trimester, because you can have giddiness spells, you can have nausea, vomiting, you can be having the drained out feeling. So no harsh exercises. I usually suggest to go for a walk and do mild exercises and continue your yoga when you're having your early pregnancy time. So it is, it's all about happy news. It is all about safety of pregnancy. It is all about taking care during pregnancy. It is all about how you move forward and look forward to a happy and healthy pregnancy. And it is very important that first antenatal checkup goes very well, because you will have your entire confidence on the doctor, on yourself, with the first antenatal checkup. And at times antenatal checkups are closer, at times antenatal checkups are a little far apart, but whatever said and done, you will be taken care as per your requirements. And first trimester visits are very, very sentimental, and you try to save some documents, and you try to save some memories, and you try to make new attachments to doctors. So it will take some time. And people who have access to obstetricians, they are lucky. People who are having access to midwives, they are the best caregivers in their situation, wherever they are. There are places where only family physicians see pregnant women. That is also okay. There are places where there is no access to any doctor. They are local random practitioners who give care. So it is very important that you have to reach out to some kind of a professional help whenever you are given a choice of antenatal care. And that way we are very lucky in India to even access to antenatal care in every given location and place. So it is very, very important that your choice is actually very well executed in our country, and where we have got ample doctors to give you that kind of care that you expect. So this is all about your first antenatal care visit, and all the reports that come have to be checked with the doctor. And I suggest that you don't Google everything and check and cross verify and all that. Let the doctor speak with respect to your body, your health, and your family history and your situation, because it is very, very important that as I have told you yesterday, you need to individualize pregnancy care and opinions. So this is all about what to expect in your first antenatal visit. At times, if you're 6 or 7 weeks, by the time you reach, you can even check your first ultrasound and look at the first heartbeat of the baby, the flicker of the heartbeat. So it's very exciting, and we will talk about ultrasound in the next coming classes. So this is all about your first antenatal visit, and you should maintain a file of your pregnancy. You should be maintaining every bit of a paper. I suggest a physical presence, because it's easy to carry wherever you're going, and at times internet works, it doesn't work. At times you may lose your mobile, or at times you might miss certain things, but a physical document, if you have it with you, it is better for pregnancy. So that's all for today, and see you tomorrow. Yet another day of we have a busy day today, and tomorrow morning see you again at 7:30. Super healthy, super mornings tomorrow morning. Bye.